There's nothing more distressing or nerve-wracking than a weak erection. You're expecting your penis to get hard and it doesn't. So it could be pretty stressful, and it could be pretty sort of unsettling, to say the least. What can cause that? Well, there are a lot of things that could cause it. Depending on how old you are and depending on the situation that you're in, various different things can play a role. So one of them could be stress. If you're having a bad day at work, or you're having a bad month at work, you're having a bad year at work, that certainly can play an important role. Another one is the various different metabolic things going on in your body. So people that drink too much, or if you've just had too much to drink that night specifically, that can also play an important role. So those are things that come and go. But then there's like more sort of organic being something that is physically wrong with your body at the time that can be provoking that. And one of them is not enough blood going to the penis, or the penis gets enough blood, but then the blood doesn't stay there, it just leaves right away. And that's an interesting phenomenon that happens particularly in young men. Now, if you're older, it's most probably, if you never get the erection to start with, then it's most likely arterial insufficiency. That means the blood vessels have gotten too narrow to get enough blood into the penis. But if you're young, and this is something that happens typically in young people, they call it venous leak. You can Google venous leak. And venous leak means the blood gets into the penis, but then as soon as it gets there, it leaves. Well, that's because the way that an erection stays hard is that not only does the blood have to get to the penis, but it has to stay there. And then the way that the body does it is that once enough blood gets into the penis, it sort of compresses, it squishes the venous outflow of the blood coming out of the penis. And that's called the venous occlusion phenomenon. And in some men, and particularly young men, there's a venous leak. So the way we know that's the case, we do a penile Doppler ultrasound, and we see that the velocity of the blood coming in is great. It's very, very high. But then where we're supposed to see a low velocity of the blood coming out, well, we see a high one. So if you can get an erection that's hard, but then the erection doesn't stay for long enough, and you're not feeling stressed, or you're not feeling there's something wrong going on in your emotions or in your relationship, then this is something that we can identify, diagnose, and treat. So there's a lot of other causes for weak erections, including hormonal imbalance, which can be provoked by several different things. For example, obesity, that can give you low testosterone and high estrogen, because fat itself has an enzyme called aromatase, and aromatase takes testosterone and turns it into estrogen, just because it's there. So it's a fat containing, it's an enzyme that's located in fat. So if you have more and more fat, well, you're taking all this good testosterone your testicles are making and you're turning it into estrogen. So that really sucks. So what you could do is you can lose weight, you can get on a diet, you can exercise, and all these great things. And these are for sure the most important things. But then there's also things that we can do with the endocrinology of it by blocking that enzyme. So there's an enzyme called an aromatase inhibit. There's a medication called anastrozole, which basically blocks the aromatase. It's an aromatase inhibitor. It stops it from taking testosterone and turning it into estrogen. So sometimes someone might not necessarily need to lose that much fat, but they do have a high estrogen and a low testosterone. This is something that we can prescribe. This video, I won't talk about all the different treatments for weak erection and low testosterone. We'll do it in another video, but just know that there are things that we can do for each one of those causes for weak erections.